My name is Ramnik Mathur. I am a consultant working with the NHS in the UK.
What are the common cancers that are routinely screened in the UK?
Okay, so there are several cancers that are routinely screened in the UK and most of the Western countries as they're becoming more and more common. But as far as I'm aware, there is no similar program in India to screen for cancers, although the incidence of all these cancers is rising every year.
What are the cancers that need to be screened for in men, and what are the cancers that need to be screened for in women?
Okay, that's a very good question. So the most common cancers that are screened for in women are the breast cancer, and the test for this is a very simple test. It's called mammogram, where a specialist X-ray is taken for the breast, and that is interpreted by the radiologist. So that rules out a lot of cancers, and if they have any suspicion, then they can progress to take a biopsy. The cancer programs in the UK for mammogram starts at the age of 40, and it is continued till the age of about 75 or 70 years in some countries, and it is done sort of every 3 years. The next cancer that is screened routinely in the UK, which is again a very common cancer, is cervical cancer, and they do what we call a swab test or a HPV test, which is starting at the age of 21 and continued till the age of about 60-65. And that will pick up very early cancers. And the reason for screening is that if these cancers are picked up early, then the prognosis, the outcome is much better if treated early. While if they are missed and picked up at a later stage, they become much more difficult to treat, and there are a lot of side effects of major treatment. The next cancer, which is common for both men and women, is called colorectal cancer or colon cancer. And the routine screening starts at the age of about 50 years for both men and women. And it's a very simple test called a stool fecal occult blood test, where they look for blood in your stool. You can again get that done arranged by a local doctor who will be able to send you a stool sample. It's a very cheap test, and it will pick up early colon cancer. If the test is positive, then they can progress to do a colonoscopy and see if there are any signs of early cancer. The next cancer, which is again very common, is lung cancer, especially in people who smoke, for both men and women. And there is no routine screening for the lung cancer in every person in the UK. But if you're a smoker, a regular smoker, or if you have smoked in the last 10-15 years, it'll be a good idea to get a CT scan of the chest, which is a low-dose CT scan, and it'll pick up. Or if you can't afford that, you can just get a chest X-ray. But if you have a prolonged cough going on, then you should definitely get that done, even if you're a non-smoker.